So this is a follow-up to the previous video, which was looking at the cranium. So just in review, when we look at the skeleton, the first thing that we do is we split the skeleton into an appendicular skeleton, which would include the arms, legs, and the girdles which attach them. And then the axial skeleton, which runs up and down the long axis of the body. This includes the vertebral column and the thorax, but also then the skull. Now, the skull is very complex, and thus the skull is broken into two main regions. The cranium, this is the set of bones which enclose the brain in a bony box, and then the face, those bones of the skull which do not. And so this then is the follow-up. And if we were then to observe the bones of the face, it would be nice to make the bones of the cranium go away, as this video will. So if we remove the bones of the cranium, which enclose the brain and once again a bony box for protection, we see that there are a number of other bones, once again called the face. I'm going to go through them in this video quickly and then more slowly with individual images. So there is the zygomatic bone mentioned in the previous video because it forms part of the postorbital bar and also the zygomatic arch. There are the two small bones making up the bridge of the nose, the nasal bones. There are two small bones just in the medial portion of the orbit where the tear duct is, the lacrimal bones. The largest bone of the face is the maxilla, or the maxillary bones. They contain the teeth of the upper jaw, also compose part of the orbit and nasal cavity. The vomer, which composes the nasal septum. The inferior nasal turbinates, which form the third pair of conchae. There is the Palatine Bone, which along with the maxilla helps to form a part of the secondary palate. And then as you can see here, the lateral view, we can get a view of these skull bones as well. So here you can see that zygomatic bone, sometimes referred to as the cheekbone because it's easy to palpate there. The nasal bone, which makes up the bridge of the nose. The lacrimal bone in the medial portion of the orbit. The maxilla, which holds the teeth, composes part of the nasal cavity and orbit. And then the lower jaw, the mandible. Now, just a couple of quick points before going into the images with follow-up videos. So as was mentioned in the previous video, when we inhale, we want the air to hit plates called conchae or turbinates, and thus cause the air to swirl around, because otherwise this air would go directly into the nasal cavity and then into the lungs. And the lungs represents the most delicate tissue that we have, simple squamous epithelia. So here, once again, one can see the nasal cavity. And because the tissue of our lungs is so very delicate, cold, dry air would really disrupt the homeostasis of our lungs, as would germs, diesel particles, etc. And so there are three plates which project into the nasal cavity known as turbinates or conchae. So once again, the turbinates in the nasal cavity are these three plates. The top two are part of the ethmoid bone, the superior and the inferior nasal conchae. But this third is its own separate bone and a bone of the face. So there's one on either side. And then these three plates, when we inhale, this air does not go easily into the lungs, but rather these plates cause it to swirl around, and this turbulence then allows it to to moisten if it's dry, to warm if it's cold, and then germs, dust, etc. Can adhere to mucus and be swept towards the towards the throat, where they can be swallowed into the stomach, instead of reaching then the very delicate tissue of the lungs. Now, one of the things that mammals possess, including humans, which is lacking in many other animals, is a plate which separates the oral cavity from the nasal cavity. So notice here in the frog, the nostrils essentially empty into the mouth. All right, in turtles, they empty into the mouth. There's no separate nasal cavity separate from the oral cavity. But mammals need that because we have large brains, we have a very high metabolism. And so therefore, to support all of our energy and oxygen needs, we need to eat a lot. And then we also then need to be breathing a lot. And as such then, there is what's called a palate, a hard and a soft palate. The hard palate is made of the fusion of two bones in the roof of the mouth, a process of the maxilla, the maxillary bones, and then this small bone here called the palatine bones. So the maxillary and palatine bones fuse to make this palate. And so thus, because of the hard palate of bone and the soft mucous membrane palate, which then goes from that, there is a constant separation between the oral cavity and nasal cavity. And so mammals like ourselves, or like these cows, can be breathing and chewing at the same time. So that is an important part of the face. And then one last video before I get back into the images is that we primates, we value protection for the eye because the eye is large and so very important. When primates are, trying to see the world during the day, use color vision, or those living in trees that are trying to, say, leap from branch to branch, they have to accurately judge the distance of nearby branches. The more protection for the eye, the better. The ancestors of mammals had bone completely encircling the eye, but the first mammals lost this. Now, some mammals have begun to develop more and more support. So if you notice in that cat, the cheekbone, the zygomatic bone, it is approaching a process of the frontal bone so that the eye now is mostly surrounded with bone. A few lineages of mammals have gotten a complete bony bar to protect the eye. That would include horses, camels, and primates. So notice in primates, including humans, the frontal bone and the zygomatic bone contact each other so that the eye is completely surrounded in bone. Okay. And so just to then go to some pictures. Oops, sorry. So the bones of the face would include, once again, the zygomatic bone, this cheekbone. Notice that it makes up the lateral portion of the orbit and contacts the frontal bone, making that post-orbital bar. Also notice that this cheekbone, the zygomatic, contacts the zygomatic process of the temporal bone. So if you see this space here, this hole for jaw muscles, so that the muscles which attach to the lower jaw can go through this opening attached here and thus be longer and more powerful. This hole is formed not only by the zygomatic process of the temporal bone, but also by a portion of the zygomatic bone here. And so the cheekbone is very easily palpated. It's very close to the skin. Notice once again, it has a portion which contacts the frontal bone and the postorbital bar and contacts the zygomatic process of the temporal bone to form this zygomatic arch. Just in the medial portion of the orbit, there is a small bone, the lacrimal bone, which has the tear duct, the lacrimal foramen, so that when we make tears, these a solution which cleanse the eyeball can then pass medially over the eye and then drain here through that opening in the lacrimal bone, and then go from there into the nasal cavity. And so once again, tears cleanse the eye, they move medially, and then they can drain into the lacrimal foramen in this small lacrimal bone. So notice that the orbit is quite complex. Not only are there bones of the cranium, the frontal, the sphenoid, and the ethmoid, which help to compose it, but also bones of the face, the zygomatic, the maxilla, and the lacrimal bone help to enclose the orbit. Not all of the bone is, not all of the nose is bone. There's cartilage and then dense connective tissue. But there are two small facial bones called the nasal bones, which compose the bridge of the nose, which one can see here as well. And so just so here would be the small nasal bones. Here are the cheekbones. Once again, this bone has been disarticulated. But notice that while some of the plates which stick out into the nasal cavity are coming from the ethmoid bone, the superior and middle nasal conchae, notice that there is one bone which is its own separate bone, and it is a bone of the face. So it is known as the turbinate, or the inferior nasal concha. So of the three plates sticking out into the nasal cavity, the inferior one is its own separate bone. Once again, the inferior nasal concha, or turbinate. The nasal cavity is split into two lateral halves because of a nasal septum. The nasal septum is composed of two bones, one of which is the ethmoid here in yellow, and one is the vomer there in more of a red. So once again, there is a nasal septum, and one of the bones of the face, the vomer, helps to form the septum. Since it's rather delicate, it can be broken in a number of sections rather easily. But here you can see a beautiful specimen where you can see that in addition to the ethmoid, which is making part of the nasal septum, you can also then have this bone of the face, the vomer. And so thus the two lateral halves of the nasal cavity are separated. Now, the vomer can also be seen. So for example, if you had a lab instructor who was going to ask you to identify the vomer, in addition to the nasal septum, you can also see it here, just posterior to the hard palate. And just if you were going to try to put a piece of tape on a bone for students to identify, this is less delicate than the part that composes the septum. Notice that the roof of the mouth separates the oral cavity from the nasal cavity. You can't touch the region you smell from, because there's that hard plate that gets in the way. This is composed not only of processes from the maxilla, but also processes of these the small palatine bones, which then fuse in to form the roof of the mouth. Somewhere. So here in purple, you can see the maxilla, but then here the pink bones there, those are the palatine bones, and together they compose that roof of the mouth. The maxilla is a large bone. It is the only bone of the face to possess a sinus. So the frontal, ethmoid, and sphenoid bones of the cranium possess a sinus, but the maxilla, once again, is the only bone of the face to possess a sinus. All of the teeth of the upper jaw are contained in the maxilla. Now, when you were an embryo, you actually had a separate bone called the premaxilla, which held the incisors. But during embryonic development, that fused to the maxilla, and so we no longer have that as a separate bone. The maxilla composes part of the orbit. All right, we see it here. It surrounds part of the nasal cavity, and once again, it forms the majority of the hard palate and holds all of the teeth. Now that the premaxilla, which once held the incisors, it was once a separate bone, has fused to the maxilla. There you can see the maxilla and the palatine forming part of that hard palate, which separates the oral and nasal cavities. Then the last true bone of the face, although I'll mention a couple others, is the mandible. Now, more primitive vertebrates have lots of bones in their lower jaw. We simply have one, and why is a very long explanation. I have videos on that. So the mandible is one single bone, the two halves fuse in fetal development, and this holds all of the teeth in the lower jaw. There are a couple of openings, like the mental foramen on this side and the mandibular foramen on this side. Those who are administering oral anesthesia need to know where the nerves which provide sensation are. And then this is the mandibular condyle, and it is the condyle of the mandible which then articulates with the mandibular fossa of the temporal bone to form the TMJ, the temporomandibular joint. We have this carnoid process, and notice there's a broad area here for muscle attachment so that we can bite and we can chew with strength, because we have these large muscles which can attach here, and then they can be long because these muscles which attach to the lower jaw can then pass through this opening encircled by the zygomatic arch. And then the muscles, the masseter, the temporalis, can then insert on the bones of the cranium. So here would be the mandible's condyle, which would form the temporomandibular joint. Now, there are in the skull, we have bones which we include in the cranium because they surround the brain, bones of the face, which I have just reviewed. There are also, as I mentioned, bones which are in the middle ear cavity, and they help to amplify sound. So when the eardrum vibrates, this causes then the malleus to vibrate, then the incus, then the stapes, and these vibrations then amplify sound a bit more than 20 times, which help us to hear. So these are skull bones, but they are not technically part of the cranium or the face. So they are in a space inside the temporal bone, where the middle ear is located. They are called the auditory ossicles when considered together. And then finally, there is this hyoid bone here. The hyoid bone surrounds the larynx. It hangs by ligaments, and it is it doesn't contact any other bone. There are a number of tongue muscles which are supported by the hyoid bone. If you were to put your hand over your throat, you could feel it when you swallow. Now, the hyoid bone actually forms in a rather complex way. So cartilages from multiple arches from when we were embryos and we had pharyngeal arches, then these cartilages then fuse together and become solid bone. So even though this is just a small semicircular bone, its embryonic formation is actually a bit more complex. And if you were to say study comparative vertebrate anatomy, then you know how the human brain, the human skull forms from its various sections, you know, would be a topic that you would consider, including, you know, the formation of the hyoid bone, which once again hangs from the styloid process from ligaments. Now, I had mentioned that the embryonic formation of skull bones is interesting, and it truly is. Sorry for, oh, come on. And so I have a number of videos on which consider the composite nature of the bones of the skull. So while we have one temporal bone, it didn't start as one temporal bone as embryos. Instead, what happened was lots of small bones then fused together to form the temporal bone. And so the temporal bone is then considered a composite bone. It has its origin in the fusion of multiple separate elements. And during our embryonic development, you can see that the temporal bone has a petrosal portion, a squamous portion, the mastoid process, the styloid process. These are all separate bones. The occipital bone forms from a lot of smaller structures which then fuse. The sphenoid forms from a number of smaller structures which then fuse. There are two frontal bones which fuse. The vomer has two halves which fuse. The mandible has two halves which fuse. There was once a pre-maxilla which held the incisors, and this then fuses with the maxilla. So just a thought, and every now and then with, say, a birth defect or an individual patient, an abnormal, fusion of, these bones, whether it be for cleft palate, the presence of these wormian sutural bones, et cetera, that may be of interest. Then finally, I know that students, struggle with, learning all of these. And so any, memory aids, are often appreciated. So just in my playlist, I include something I do with the class, it makes everybody laugh and it's kind of fun. People break this into group and they pretend that it's a zombie apocalypse and that they have to throw their textbook at individual zombies. And after throwing the textbook at the zombie, it bashes in a skull bone, and then they have to quiz themselves on which, skull bone was hit, there. Was that, the parietal bone, for example. What bone was hit here? Well, that would then be the sphenoid bone. So once again, if you were trying to quiz yourself in a way that might help you remember, but also kind of be funny, that might be something of interest. And then also, if you're just memorizing terms like this skull bone has these parts, etc., that's kind of dry. But once again, as I've tried to introduce here and there, our skull bones are actually fascinating and have helped make us who we are, we humans. That the hard palate, the postorbital bar, the expansion of the cerebrum, the brain, which was allowed by the expansion of the skull. And so another activity I do with my classes is just I have them vote on if we were to have a contest, which of the skull bones was most interesting to you, which would it be and why? And then we go through some of the interesting things. Once again, part of this is in the interest of making it more than just dry memorization and enriching the material and thus making it a little easier to remember. And so that then is the conclusion of the two videos talking about the bones of the human skull, with this video focusing on the face and also mentioning the hyoid and the auditory ossicle.